As we mentioned, MDCs are comprehensive groups housing medically similar diagnoses or conditions belonging to the same organ system. And because there is such a variety of treatments possible, MDCs will be further specified into these two groupings, surgical or medical. If a patient has a qualifying procedure performed during the inpatient stay, their case will go on to one of the surgical DRGs. But if there was no qualifying procedure, the case is a medical DRG. So let's continue with our example in here. We are back to the main page of MDC 05. MDC 5 has a long list of surgical DRGs and connected procedure codes. You can see the header here, surgical DRGs, operating room procedure of, and then we have to find what happened to our patient. By clicking on any of these headers, a list of procedure codes come up that can qualify the patient for falling into one of these DRGs. If the patient had any of these operating room procedures and nothing else, they will fall into DRG 215. There is a variety in these listings though, so be careful when you are assigning DRGs. For example, if we come here, we see a simple list of procedures. If any of these is performed for the patient, they probably qualify for DRG 215. But if we go to the defibrillator category, we are presented with a very different look. First of all, we have combination procedure codes, so more than one will have to be performed, a whole cluster. Then we also have this table up here that immediately clarifies the DRG further, asking us whether there was myocardial infarct present, heart failure, or shock. We also have to know whether cardiac cath was performed for this patient and whether there was an MCC, a major complication or comorbidity, or not. When you see something like this with more details, don't panic because all the codes are given to you. While deciding whether the patient qualifies for any of these conditions, you can find the diagnosis codes by scrolling to the very bottom. It starts here, and then we go on to page 2. Do you see page 1 of 2? This is how you know it. We go on to the second half of the diagnosis. So this is what the table is asking you about when it asks whether there was infarct, shock, or failure. As for the other question about cardiac cath, these procedure codes are also here for you. To reach the cardiac cath codes, so if any of these was performed for your patient, then you can answer yes to that question in the table above. Notice how it says non-operating room procedures. This is a good reminder for us that not every procedure will have to take place in the operating room in order to factor into the DRG. If the case we are coding for has any of these procedures coded, it will count as a surgical MDC, and the next step for the grouper would be here to determine the appropriate surgical hierarchy if more than one procedure was performed, or it can maybe assign the case to an unrelated procedure DRG. That just means that the patient's principal diagnosis and the performed procedure have nothing to do with each other. There is a separate DRG for that. We are not going to go into detail on how to pick the appropriate procedure from the surgical hierarchy because I'm trying to keep this video under an hour, but please know that there are separate appendices where you can find this information. Appendix D, E, and F will help you with the surgical hierarchy and with all the procedure codes. Now let's get back to our case and assume that there was no procedure performed. As I mentioned already, if there is no procedure, then this will be a medical case, right? Because that was our choice. We either go to surgical based on procedure or we go down to medical if there was no procedure. We are back to MDC 5. We decided, let's say, that we do not have a surgical case. So we have to scroll down, down, down until we find medical DRGs based on the principal diagnosis of, and now we have to find our code I-440. I-440 was a cardiac arrhythmia, It will be right here, principal diagnosis. So we know again that we are at the right place. Because we know that there was no procedure performed and we fall into MDC5 under cardiac arrhythmia, we know that our final DRG assignment will have to fall into one of these DRGs based on the presence or absence of complications and comorbidities.